Andrew, joint pain videos call MSM a breakthrough sulfur powder that finally calms aching knees. If someone is already icing after stairs and sees that claim, what part is real molecule biology? And what part is marketing theater riding on the word sulfur like it is some missing essential?
MSM is methylsulfonylmethane, a small organic sulfur compound sold as capsules or loose powder. The honest opener is not miracle cartilage rebuild and not a vitamin deficiency rescue. It is a concentrated sulfur exposure people by hoping to quiet joint irritation signals after walking, lifting, or long desk days. That hope needs a mechanism story and human outcome data, and those two things are not automatic twins just because the label says sulfur for joints. The proposed path is anti-inflammatory and antioxidant. MSM is framed as calming cytokine noise and oxidative stress around irritated soft tissue and joint surfaces. In plain language, sellers argue the powder turns down the chemical static that makes a joint feel hot and cranky after repetitive load. That is a plausible mechanism story from supplement research summaries. It is still not automatic proof that stair pain or walking distance will improve for every adult who pours a scoop. Tiny amounts of related sulfur chemistry show up in some foods in the body's normal sulfur pool, but capsules are a different exposure class. Food traces do not automatically justify high-dose powder logic, and absorption claims should stay modest without person-specific labs. NCCIH also reminds us that the bottle you buy can differ in important ways from whatever powder a study actually tested, which matters before anyone treats a retail scoop like a published protocol.
Then why do recent MSM papers talk about laying hens and malondialdehyde instead of people on stairs? Is a lower MDA number the same thing as my viewer feeling less knee grind after a week of errands? Or are we watching a biomarker story get dressed up as joint relief?
Exactly the trap. In those feed-restricted hens, dietary MSM raised final body weight and feed intake, nudged some egg quality traits, and reduced malondialdehyde in serum and yolk, especially around the 0.5% diet level. That is useful oxidative stress biology in birds under a stress protocol. It does not show that a 40-year-old with medial knee pain will walk farther or sleep better. Keep biomarker change, symptom scores, and hard clinical outcomes on 3 different shelves before you let a chart sell your joints. There's a practical safety of inference issue too. The bottle on a shelf may not match the lot used in any paper. NCCIH is blunt that store and online supplements can differ in important ways from research products. And FDA consumer guidance treats supplements as a regulated but not identical class to drugs. So even a promising joint trial does not automatically transfer to whatever brand someone clicked overnight after watching a sulfur breakthrough clip.
So if the human story is mixed and often short, who is the least wrong person to run a careful personal experiment with MSM for a few weeks, and who should skip the aisle and go straight to a clinician instead of collecting another bottle?
The fairest human read is mixed. Some short, small joint pain trials report modest symptom movement for some participants, and older osteoarthritis-focused reviews of MSM and related sulfur compounds stay cautious rather than triumphant. Audience videos love breakthrough language. Evidence-facing summaries usually sound quieter, maybe a little less ache for some people, not cartilage regeneration, not a replacement for strength work, and not a reason to ignore swelling, locking, or feverish joints that need diagnosis first. On dose, application reviews often place common adult discussion in the low-gram range and describe MSM as generally well-tolerated at amounts talked about up to about 4 grams daily, usually with few and mild side effects when problems appear. Hear that as tolerability context, not a universal target dose for every knee, and not permission to keep climbing because more sulfur somehow sounds stronger. Long-term safety and interactions are still less mapped than marketing suggests.
If I try it anyway after that caution, what should I track so I am not gaslighting myself with placebo vibes or one good weather day? Pain at rest, stairs, morning stiffness minutes, or something more boring and measurable that I can write down before the first scoop?
Pre-commit 1 or 2 markers for several weeks before you open the bottle. pain on a familiar stair flight, minutes of morning stiffness, or walking time before the ache rises. Write the baseline down on day 0. If those numbers barely move, stop instead of stacking mystery blends. Keep strength work, sleep, and load management in the frame the whole time. MSM is an adjunct candidate with mixed odds, not the whole joint program, and not a reason to abandon basics that actually load the tissue wisely.
Whereas the hard stop before this becomes reckless. If someone is pregnant on a complicated medication list, heading into surgery, or chasing pain that is hot, swollen, and waking them at night, does MSM stay on the table at all? Or is that when the aisle is simply the wrong room?
Hard stop means clinician first for pregnancy, complex medication lists, planned procedures, or joints that look infected or badly inflamed. For a mild mechanical ache in an otherwise stable adult, MSM could be a time-boxed adjunct with mixed odds and modest expectations. Remember, the sulfur story and the anti-inflammatory pitch are louder than the proven pain signal. MDA shifts are not your knees verdict. And the fairest close is curiosity with a stopwatch and written baselines, not loyalty to any breakthrough thumbnail online today.